Results show that this is lung cancer. The next step is to get your PET scan, your MRI, and your plating test done. So I'm going to keep moving things along because I do not want to delay things.
Okay.
Once we get all of the studies done, it takes approximately 2-3 weeks for me to get everything together. Hopefully 2 weeks rather than 3. Again, I don't know because of your insurance issues if there's going to be a little bit of a hiccup. Because it's just not me. I have to
Yeah,
deal with
yeah.
radiology. I have to deal with all of the other stuff.
They did say, you know, you put in a request to the VA, but see, if you put in a request to the VA, they may want to move it back over there.
No,
They
That's the
will, they're
problem.
not.
with Dr. Fiorella.
I think I gotta look at my schedule. I think it's maybe this week.
Okay.
Yeah.
I spoke to him this morning.
Mm-hmm.
I reviewed your pictures and stuff. He's gonna set up the radiation, he's gonna set up the chemotherapy schedule and stuff like that.
Okay.
So I need you back to see him. If you don't see him within the week, give me a call and I'll give him a call.
But you're still my main doctor.
I'm your lung doctor.
Okay, so everything has to go through you.
I'm involved in everything.
Okay.
So, like when Fiorella does anything, I get copies of everything that he does.
Okay.
Okay, so I keep track of everything, but right now your focus is chemo and radiation. And that's where your focus needs to be, is to get those two things done. Now, are you coughing up any blood?
Not anymore. Not
So that, since I've gone in there.
yeah, that's over. It's just little white.
Okay.
Just, occasionally I cough up phlegm, but I'm using that thing that makes the
Right.
yeah, and that gets out stuff.
But, and no chest pains, no fevers?
Yeah, this I think I sprained my
That's
arm.
got nothing to do with your tumor, Bobby.
Oh, okay.
That's something completely different. Remember I told you about the frozen shoulder business?
Yeah,
I think that's what you got. That has nothing to do with your tumor.
it's okay.
Okay, so right now, like I said, the focus is radiation, chemotherapy. Depending on how well or how poorly you do with it, then we're going to have to come up with a plan as to what we're going to do next.
So, since our last visit,
I bet you're gonna trick out about my breathing because he could hardly register. When I was in there, I don't know, with a 30% lung capacity, what they expect?
have you seen the radiation doctor?
No,
You haven't seen the radiation doctor.
not yet.
Um,
But wait a minute, don't I start my treatments Monday?
well, I thought you saw the radiation doctor, Dr. Fryfield.
Yeah, I saw him.
Yeah.
Come on.
Sorry.
Hi, how you doing?
Fine.
Dr. Joe Fiorella.
Hi, Melody, thank you.
Sure. So, and of course we discussed your, well, where I was going with this was, assuming you'd seen the radiation doctor, which you have, we discussed your case at one of our tumor boards, and there was no role right now for surgery. What we need to do is we need to try to shrink the tumor down with radiation and chemotherapy. And it sounds like you're scheduled to start on Monday.
Mm-hmm.
Okay. So, to follow up on some of the things that we talked about last time, but with a little bit more detail, chemotherapy acts like poison. You're trying to poison the cancer cells while not harming the good cells too much.
Yeah.
Right? And this type of therapy, which is a traditional type of cytotoxic chemotherapy, a poison, if you will, is given intravenously through a port. Have you had a port placed?
No, we can't do that with oral medication.
Or a PICC line?
What's that?
No, or another
No, he
catheter?
hasn't had anything.
No.
Okay, okay. So we need to, work on getting that,
But if they're again, you can't do this orally.
no,
Why not?
because that's not the way the therapy is delivered. It's not the way the drugs are delivered. It's intravenous.
Okay.
Because everybody's cancer is a little bit different.
Right, exactly. There's, it's not the cancer, it's what type of cancer, because there's 200 different types. So in each type, there's a number of subtypes. So in the subtypes, we're learning that we can further categorize tumors based on their genetic makeup, and then of course every patient has different strengths and weaknesses. But in this case, we wouldn't typically use an oral therapy with the radiation because there isn't any. That would work. The intravenous therapy would work though, and this is still potentially curable, so that's what we want to try to do. You kind of have one shot at this, and you want to be as aggressive as you can. Now, there's some therapies which are oral that are more toxic than intravenous. Just because intravenous doesn't mean that it's more toxic necessarily, right? Just another way of delivering it.
But based on his pathology, when they did the biopsy, does that tell you guys more of the direct nature of the type of lung cancer this is that responds to the correct treatment?
Right. That's why we've chosen the chemotherapy drugs that we've chosen. 5-FU, 5-fluorouracil, and cisplatin are the names of the two drugs. What are some of the possible side effects? Nausea, vomiting, diarrhea, constipation are all possible. They don't tend to be as big of an issue today as they were years ago because we have such good drugs to prevent nausea, and you'll be receiving them with the chemotherapy. Okay? And I'll also make sure that I send them home with 2 other drugs to help prevent nausea.
I just have to tell you,
Thank you.
I think those are really cool.
Okay.
Now we're good?
Yeah.
So back to they work together as a team.
Yes, so I was just talking about why do we all get together in the same room and talk about people? It's because everybody has a certain perspective. We work together all the time, so we kind of know what each other generally thinks and generally is going to say between the lung doctors and the medical oncologists, the radiation oncologists, the surgeons, pathology, radiology's there to show your x-rays and things like that. So anyway, we all had a chance to talk about you and looked at your scans and looked at the biopsy slides and all that sort of thing. Felt like radiation and chemotherapy together is probably the best way to go for you. And that's not, just earth-shaking kind of information. That's pretty standard stuff. But the point is, it's good to have all of these minds kind of working together for your particular case, I think. And you know that sometimes people say, well, should I get a second opinion? Well, you got
We've
about
had like
eight.
5.
Yeah, actually. So I think that's a little bit helpful. Anyway, so the point is, I've seen your scans and I've seen the pathology from the biopsy and all that sort of thing. Now, you had an MRI of your brain. Did you hear that looked okay?
That was fine.
Yeah, that looked good. So nice looking. Brain.
Yeah, thankfully.
Yes, you have a brain.
Given his
I can
age.
verify that you have a brain, and
Uh-huh.
it's a really good looking brain. So we always have to check because sometimes there can be some pieces